A stroke is a vascular disease, much like heart. So heart and stroke are actually both vascular diseases, and they're just different organs. So stroke impacts the brain. We call it kind of a brain attack instead of a heart attack. But they are both vessel driven, and you can have two types of stroke. One is a hemorrhagic, which is where the blood vessel is weakened and it will break, or you have a sac that ruptures, an aneurysm we call that, and that would be a hemorrhagic stroke. And we have ischemic stroke, is where you would have a clot blocking the vessel. The ACT FAST acronym is developed so that people can identify rapidly the symptoms of stroke: face weakness, arm weakness, speech difficulty, and calling 911. We've added the BE so that not only are we catching anterior stroke circulation problems, that we're also looking at the posterior circulation. So B is balance, and that is in the occipital lobe in the back, and also is your vision. So we look at eyes. So do you have any visual difficulties? Calling 911 is extremely important because every minute you're losing about 2 million brain cells during a stroke. And not many of us care to lose those brain cells because we don't ever get them back. Hopefully they can get treated with a medicine that would help them improve their symptoms and their functional outcome right away, but most of them will have some residual effect. So we have them be evaluated for rehabilitation right on admission. We have that on a part of their orders, so that our occupational therapist, our speech therapist, our physical therapist, and our physiatrist all are a part of the program right from the very first moment they come in. Stroke impacts not only the survivor but the entire family. So we want to treat them not only as a survivor but as a family, the caregiver, their children, the entire family. And once you have a stroke, you're at risk for having another stroke. That's the unfortunate part of a vascular disease, is a lot of times you're at a 40% risk of having another stroke. So we really want to work on secondary prevention, which is once you've had it, now we want to prevent you from having another. And family hereditary can play a role, and we want to make sure that the family members understand their risk factors as well. So once you've experienced a stroke, those brain cells that you had are gone. So the brain cells that died in that area of the brain that was impacted are not coming back. So I have a lot of patients tell me, I love to golf, and I don't like it anymore. I don't want to go out and golf. Yeah, well, maybe that pathway that they had there was now gone. They have no interest in doing that. So we encourage them to not to look back at what they liked or used to do, but to look forward and learn new things. I highly encourage people to attend the stroke support group, because when you lose the ability of one arm to work and you have to rehabilitate it, it takes a tremendous amount of energy, and it's all work. And if this work that you had to do is now, instead of stacking cups, is now brushing a horse or a dog, and then if you can share that experience with others, you not only do you improve your own outlook, you're encouraging others to improve. There is no rule book or set of tools that's going to take you home and say this is how you manage this. And when we open up the table to talk to other survivors, it's not coming from somebody just telling them what to do. They're hearing it from people who actually lived it. I just think knowing that door is always open wherever they are in their journey, to know that they can find help at Bellin at any time.